Hi everyone! Welcome to episode 7 of the Two Hands, One Heart Life Skill Series. I am Jordan Welker, Miss Roanoke Valley's Outstanding Teen 2020. If you have not watched episodes 1 through 6, please watch those first to be able to accurately follow along with the series. As always, I want to reiterate that I am an American Red Cross licensed CPR, AED, and first aid instructor, and this online series is not a formal certification course. My intent behind these videos is to give you a skill to practice and learn if you are in a situation where you may need to use this knowledge. The topic of this week's episode is CPR. This is part 1 of 2. In this episode, I will cover each component of the CPR skill. Learning each component individually will help you to accurately administer CPR with confidence. The first component of CPR is body position. Body position is important because we want to make sure that the patient is on their back on a firm and flat surface. For the responder, you should be kneeling beside the patient, placing the heel of your hand on the center of the chest, with your other hand placed on top and fingers interlaced. Make sure that your fingers are off the chest. Your shoulders should be directly above your hands, and your elbows should be locked. The second component of CPR is compressions. Once you have the proper placement, you should begin with 30 chest compressions. Make sure your arms stay straight and compress at least 2 inches, letting the chest return to a normal position in between compressions. Push hard and fast, aiming to stay between 100 to 120 beats per minute. For a child, everything is the same except you will only use one hand for compressions. Make sure to count your compressions out loud so you know when you reach 30. The third component of CPR is opening the airway. First, place 2 fingers under the chin and 1 hand on the forehead, and gently lean the head back to open the airway. After tilting the head, use the hand that is holding the forehead to pinch the nose. The fourth component of CPR are rescue breaths. It is recommended to use a barrier while giving rescue breaths, but if one is not available, or you are not comfortable giving rescue breaths, give compressions until EMS arrive. To administer rescue breaths, completely seal the person's mouth with your mouth and blow for 1 second while looking to see if the chest rises. If the chest does not rise, give a second rescue breath. After 2 breaths, complete another 30 compressions. Continue with these 4 components until you see an obvious sign of life. Another responder is available to switch. You have performed 5 sets of CPR on a child and are alone, prompting you to call 911. EMS personnel take over, you are alone and too tired to continue, or the scene becomes unsafe. This episode was packed with new information, so feel free to rewatch it anytime if you need a refresher. If you have any questions, leave me a comment or send me a private message, and I'll be happy to answer you. I hope to see you next week for CPR Part 2. Stay safe and save lives!